today we are going to discuss about the partograph topic. Okay, it is very important topic for anyone who is undergoing any internship, or even it is very important for our PG entrance like NEET PG and initiate exam also, and it is also important for resident doctors who are in obstetrics and PG, and so it is very important topic. And firstly, I want to talk about that partograph. It is mainly for the fetal and maternal monitoring, and for our sake of interest we have got it. It is of three parts. Firstly, the uppermost part, and then middle part, and the lower part. Firstly, in the upper part I will first discuss about the whole topic, then I will discuss how it is on the partograph should be maintained. Firstly, at the uppermost part there should be a fetal heart rate, and fetal heart should be monitored at every 30 minutes. Then we have to go for liquor, and liquor there should be intact. It should be meconium stained. It should be blood. It should be clear. For intact we as I, M, B, C. Next is the molding. Molding is the fetal head in which we have to look for the overriding of the parietal bones. Okay, and it should be marked as 1 plus, 2 plus, and 3 plus. And what is 1 plus and 2 plus and 3 plus? Firstly, in case what is 1 plus is touch each other. That is the parietal bones. In case of 2 plus, bone overlapped but can be separated. 3 plus, bone overlapped but can't be separated. Okay, so this is the molding, and firstly this is the uppermost part. This three part is in the uppermost part. Next is the middle part, in which there we have to monitor about the cervical dilatation and descent of the head. Firstly, in case of cervical dilatation we have to maintain in the partograph like as cross, and in case of descent of head like head hai to goal. Okay, like circle. Next, in the cervical dilatation it should be maintained at every 1 hour, and there we will discuss about what is the clinical importance of cervical dilatation monitoring in partograph. In case of descent of head there should be also like at 1, 2, 3, 4, 5, and you know about that it is determined about the respect of ischial spine, how much it is above or below the ischial spine, so descent of head. And lastly, the lowermost part, that is the it contains about the uterine contraction, and next is oxytocin. Next is drugs given in IV fluids, pulse rate, blood pressure, temperature, and urine. Okay, and the urine, protein, acetone, and volume. Firstly, for uterine contraction it is monitored at every 30 minutes. Okay, for pulse rate it at every 4 hourly, BP 4 hourly, temperature 4 hourly, and urine at every 4 hourly. So this is our one of our basic concepts about this topic. Okay, and now we are going to the main topic. How will you plot this in our exam? So first, the fetal heart rate at every 30 minutes. Just here, if we found here that is 130 at first hour, so we are denote at 1. Then suppose it found in the next 30 minutes after 140. Then suppose it is 150. ऐसे करके प्लॉट करना है, ठीक है. So firstly, this is the fetal heart rate. For liquor, we can suppose we found there should be any meconium, then we have to lose meconium 30 minutes after meconium, then 30 minutes after meconium. ऐसे लिखना है. Molding, suppose we found there is 2 plus, so we have to mention it 2 plus. Okay, and next is this is about the fetal, that is the part 1. Next is the cervical, next is the cervix, that is the how we look. Firstly, you should plot. Firstly, you have to know that is the 1 centimeter per hour. Firstly, this is about for 1 hour. And you have to always look for, this is an alert line and this is the action line. And firstly, when you have to start the plotting, you start at the alert line. So suppose here, and after 1 hour I found there is something dilatation is here, तो यहाँ पे प्लॉट कर दिए. सपोज 2-3 घंटा बाद हम जब कर रहे हैं या फिर 1 घंटा बाद करते हैं, 1 hour after, suppose we found it here, there is no progression at all, then here, suppose next hour here. So we can see this is the cervical dilatation plot, and you have to look if you find it in here and in the alert line. Okay, means in this portion, in the alert line, you have to go for normal delivery because the progression is good. But suppose we found there is in the that line, that is the between the alert and action line, but not touching the action, in this region there should be, we think about the dilatation is not proper, not it 1 centimeter per hour. Suppose less than 1 centimeter per hour, then we have to think this is a slow labor. So we go to for referral the patient. And suppose you have found that the dilatation at around the action line and in the right side, then we have to think for, it is a case of intervention, we have to must go for intervention like rupture of membrane something. For descent of head, we have to plot it like 0, like O. So suppose here, then we found at 1 hour here, then here, then here, then here. So suppose like plot. Okay, so this is about the cervical dilatation and descent of the head. Next we have to look for at the contraction per 10 minutes. So firstly, if it is found like dots, and next thing can you found at like this, and next time you can find like that, keep full of black. So if it is dot, then uterine contraction less than 20 seconds. And if you join the dots like that, this is the thing, that is the 20 to 40 seconds. And if you fully black this is something more than 40 second contraction. So suppose you can find like that, okay, and then like that. So this is the plotting. And you have to know that if the if you want to know about the adequate uterine contraction, it is at least 3 contraction in every 10 minutes for 45 second duration. But if the contraction is more than 5 in 10 minutes, then it is about uterine hyperstimulation. It is one of our very favorite NEET PG questions, and there should be a history of misoprostol given in the pregnancy. This is in how you have to plot it like that. Okay, next is the oxytocin, and it is very simple. In case of oxytocin, how much unit you have given, that should be mentioned. Suppose you have give 10 international unit, so like to draw E. And next is the drops, and how much drops you are giving per minute, that drop should be mentioned, and you have to monitor as your time interval. Okay, next this is the drugs given. Suppose you are giving the patient tranexamic acid, so you have to like that the tranexamic acid has been given, and it is for how much duration, and also the IV fluid how much is given. So whatever you give to the patient, everything is monitored in one single page of a Partograph chart. Next, obviously for pulse and BP, and it is as simple as that. For BP, you suppose systolic blood, suppose you have found the systolic blood pressure 140 and 90, then like that key 140 and 90, then you just go at dot. This is the for pulse, this is for BP, and for pulse rate simply you at every 4 hour interval you go for pulse rate. Then suppose like that, यहाँ पे pulse firstly 1 to 10, then suppose 150, 140, then just join this. So this is as simple. And urine protein, you know. So this is the whole basic concept of Partograph chart. In case of in case of urine, you have to just mention about how much the volume you have found at the timely interval, how much about the proteins you have found, just like that. There is no such difference, just according to the data you have to fill up, and this is the whole basic concept of Partograph chart. So please go through this. This is the thing.